Hello, and thank you for tuning in to Your Soul Priorities. My name is Tuaca Kelly. Please give a warm welcome to my guest today. Dr. Kenneth Stoller is a fairly incredible man, and I want to share his brilliance and expertise with you today. Welcome, Dr. Stoller.
Thanks for having me, Tuaca.
Thanks for being here. Some of the things that I know you for is your incredible work in hyperbaric medicine, your work with autism, and other areas that some physicians stay away from. And you've also recently published a great ebook on oxytocin, so I'd like to kind of bring these out and introduce your practice of medicine to people who may have not heard it before or just wanting to dive in and get a better sense of it. So if you tell us a bit about hyperbaric and the benefits therein, how you utilize that in your practice.
Well, hyperbaric oxygen is just what the name implies, increased pressure and oxygen. And what oxygen does under pressure is it acts as a DNA signaling agent to do a lot of things, thousands of things, but perhaps the most important thing that it does is it reinvigorates the mitochondria in our cells. Those are the energy centers or fuel cells in our cells, and it allows a level of healing to take place that normally wouldn't be possible without that environmental change, the pressure, actually the pressure being more important than the actual concentration of the oxygen itself. So we end up treating brain injuries, strokes, cerebral palsy, all the way to treating Lyme disease, where the hyperbaric oxygen acts as an antibiotic. So it does a lot of things.
When does that shift happen, or what's the actual chemical shift in the body where it begins to act like an antibiotic?
Well, in the case of Lyme disease, which is sort of a facultative anaerobe, so it can tolerate oxygen up to a point, but then it will die if the oxygen level gets too high. So in the case of Lyme disease, it's 160 millimeters of mercury pressure, which is what we're breathing in at sea level. But just because you're breathing that into your lungs, it doesn't mean that level of oxygen stays that high as it gets into your bone marrow or the tips of your toes. So under hyperbaric oxygen conditions, you can bring that partial pressure of oxygen up very high, even in your bone marrow, where you're dealing with hundreds of millimeters of mercury of oxygen pressure, and that will kill that particular organism. I'm oversimplifying. Sometimes it's a very difficult infection to get rid of, and you have to do a lot of other things at the same time, like take enzymes and whatnot. But that's how it works.
Sure. The technology and the invention of hyperbaric chambers is, it wasn't just invented, it's been around for a while, but its use in medicine has become kind of more popular. But when you got into it, it was still pretty avant-garde or even rebellious. What was it within you that went from a shift? I believe you started in pediatrics to make what some would consider a radical shift into this new field.
Well, I had a friend who was the head of Apple Computer's Advanced Technology Group, and his wife found him dead in bed, and when he was revived, they never found out what caused his heart to stop, but he ended up being in a coma for almost 2 weeks, and I couldn't believe when I visited him in the hospital that the therapy he was being offered was nothing more than an IV drip. And so there has to be something more we can do for someone in a coma from an anoxic event than just give them an IV. And that sort of started me on this path. And then when I found out that it could help children with cerebral palsy, Since I was an active pediatrician at the time, I couldn't resist getting more involved in it. So that was in the mid to late 1990s when that was happening for me.
How was that received? I'm curious, and I come up upon another point that I appreciate too that we'll get to in a moment, but how was that received by your colleagues or your peers when you were making this shift in medicine? What was kind of the popular viewpoint?
Well, basically, it's like I stepped into, out of the matrix, and I wasn't seen anymore for the most part. Most physicians are so brainwashed by pharmaceutical companies, they have no idea they're enslaved by them. And if you show them something out of the limited paradigm that they work with, they just don't even see it. They don't see it, they don't recognize it, and they don't want to have anything to do with it.
Yeah, and this is exactly the point I wanted to get to about what I most appreciate about you is that just for transparency, I'll just say Dr. Stoller and I have known each other for a few years, and in some cases, I refer clients and he refers patients when that's appropriate in the person's care. And what I know about you is that you are a man who thinks for himself. And I feel that that's a precious commodity for any individual, and particularly for someone who's kind of been indoctrinated in a particular group. And that also includes, medical school and everything that goes with that, like how to maintain your personal morality, your personal sense of do no harm, thinking for yourself, really feeling along intuitively, soulfully with your humanity in what situations are, and how to really create authentic healing potential for people. And this quality I find to be really precious in you, and one I would like to, also kind of carry over by asking you how would you introduce critical thinking to your colleagues, whether they be baby docs or senior doctors? How would you say to them, kind of wake up?
Well, it's hard because most physicians they think for themselves, and that they have their patient's best interests at heart, and that they can be making informed decisions for those patients. So it's really hard to wake up someone who thinks they're already awake. It's like entering someone's dream and saying, you're in a dream. This is not Earth reality, and they'd look at you funny, like, what are you talking about? What do you mean I'm in a dream? It's not easy, and there are things that are not sponsored by pharmaceutical companies. They get published in the literature, and they could even be double-blind, randomized control studies. But I asked Dr. Amen, because I work with Dr. Daniel Amen here in California. I says, how many double-blind studies does it take before a therapy that is not sponsored by a pharmaceutical company to take hold in medicine? And he said, 3 or 4, and that doesn't sound like a lot, but you have to remember to pull off a large double-blind randomized control study for something that doesn't have the financial backing that pharmaceutical companies bring to the table when they fund these studies. That can take a long time before somebody or some private party or a charity funds these large studies. So something that could be really useful for a lot of people sometimes takes several decades to filter into the practice of medicine if it's not being backed by a pharmaceutical company.
Yeah, it is quite a lengthy process and an extensive one at that. And that's the other piece where critical thinking comes in, and also really being in communication. If somebody is holding the bias that a modality of treatment or method of treatment hasn't been approved by another body, they may set up a bias straight away. But in the area of being recognized, you mentioned Daniel Amen. So for our listeners, that's the Amen Clinics. And he's has a few clinics throughout the United States. You're based in Northern California, but you're the chief of hyperbaric in several areas. How does your role spill into education to begin to open the minds of the ones who do not realize they're in a dream? Where is there moments for that or contact for that?
Well, I think one of the interesting features that I have learned from working at the Amen clinics is the large number of people who come there who have unrecognized traumatic brain injuries. And of course, hyperbaric oxygen is a pivotal, if not a quintessential therapy for treating brain injury. And so I think it's going to filter out that way, that hyperbaric oxygen will eventually become recognized as the standard therapy for treating children with cerebral palsy, people with fetal alcohol syndrome, and from an old traumatic brain injury, because in psychiatry for the last 150 years or so, we have been operating blindly. We don't look at the organ that we're treating, and I don't think there's any excuse anymore for not looking at the organ that you're treating and just guessing at what might work for them with the brainwashing assistance of the pharmaceutical companies. So taking a look inside the brain with functional brain imaging really brings a paradigm shift in how to approach people with mental illness, behavioral problems, something as simple as ADD or anxiety, and all the way to traumatic brain injury.
Mm-hmm. Well, I've experienced the benefits of taking a dive, parlance, around the lab, experiencing hyperbaric oxygen therapy. It's quite wondrous, and the people that I've sent to you to have that experience, it's been shifting for them as well. ADD, autism spectrum. I'm going to turn to your book, Oxytocin, Hormone of Healing and Hope. It's a great ebook, and I want to put in the chat so people can enjoy this for themselves. Oxytocinhealing.com. You can download it for free there or purchase one by way of Amazon.com. Your discovery of oxytocin is quite personal, and you share that in your book and the benefits of that with these challenges or lessons that we mentioned.
So oxytocin, not to be confused with Oxycontin, because half the people I talk to, they raise their eyebrows and I immediately know they're hearing one thing when I'm saying another. Oxytocin is the cuddle hormone, the hormone of friendship, and oxytocin is a hormone, a peptide, a nanopeptide that the brain uses to block inappropriate anxiety, fear, and obsessive negative thoughts from entering the limbic or emotional centers of the brain. And it's quite powerful, but it can be used by almost everybody, and without side effects. Now, there's always, a rare individual who will have an unexpected or untoward reaction to just about anything. So nothing's 100% with 100% of the people 100% of the time. But having said that, oxytocin is an incredible tool for helping people gain emotional equanimity. And how long you need to take it and how long it takes to kick in depends on how long you've been cooking with whatever your situation is. So if it's very acute, it'll kick in right away. In the case of schizophrenia, and yes, it can be used for schizophrenia, it can take 3 weeks to kick in. But all women should just be on oxytocin all the time unless they're at the end of their third trimester of pregnancy, in which case it'll cause uterine contractions. But it helps anabolic bone metabolism, so it treats and prevents osteoporosis. It protects against breast cancer. And boy, if this were a drug, just for those two indications alone, you'd be seeing commercials on a TV in the United States almost every 10 minutes for it. But its real strength is what it does emotionally for people, giving them emotional equanimity.
Okay. With all of these benefits, how come we're just hearing about it thanks to your work, and how come it's apparently difficult to get?
Well, you're hearing about it only because I'm talking about it. This is not something a pharmaceutical company is going to be making money on.
Right.
And if a pharmaceutical company isn't going to be making lots of money off of something, they're not going to tell you about it. It's really that simple. So if pharmaceutical company has found something that could save thousands of lives every day, but they can't find a way to make money using it, they're not going to tell you about it. And they'll put it on the shelf for 100 years if they have to, until they can find some way to make money off of it. So they're not in the business of helping people or being humanitarians. They're in the business of selling their drugs. Now, your question as to the second part of your repeat the second part of your question.
Your discovery of it, which could have been my first part, but the discovery of it.
I started using oxytocin because a lot of times when the brain is healing, a brain that's either had a stroke or a traumatic brain injury, and that brain is coming back online again, it can get quite anxious. So I've been using oxytocin for a long time to treat the anxiety issues a healing brain will experience. And so when I had my own personal bout of issues when my son was killed, I realized right away what a powerful tool it was for relieving anxiety and allowing one to process grief, and just an incredible, I'm sure there's more powerful anxiolytic agents than oxytocin, general anesthesia being perhaps at the top of the list, but you're not present when you're under the influence of general anesthesia, and whatever your situation was before is there waiting for you when you come out of your general anesthesia. So oxytocin does not change your sensorium. It does not make you lose discernment. It does not make you high, and it's as harmless as just about drinking water for most people.
Mm-hmm. Oxytocin, I would say, depending on where the water is coming from, but oxytocin is produced in the hypothalamus, and I'm wondering here now, looking at people with autism, things falling in that range, if their hypothalamus is overactive or underactive in their production of this hormone, and what the correlation is with that. Do you get any experience with that?
Well, the oxytocin levels in many of the individuals who are on the spectrum, as I like to call it, because I don't like to call people's diseases by their symptoms, and autism is a collection of symptoms. It's not a disease. Most people who have these symptoms have an encephalopathic situation, like a post-viral encephalopathy or a vaccine-induced encephalopathy. So that's their actual disease, but they may have autistic symptoms as a result of that. So it's a little like calling someone with multiple sclerosis, which just means multiple scars. That's not the disease. That is the symptom. Mm-hmm. Or one of the symptoms is to have multiple scars in your brain. So you wouldn't go to a doctor with chest pain and expect him to diagnose you with chest pain. That's what you came in with. You want to know if
Exactly.
there's a knife sticking in your back or you're having a heart attack, and all they do is get, well, yes, you have chest pain. Take these for your chest pain.
Yeah.
It doesn't make sense. So, really, medicine today, despite all the incredible modern tools that we use, is still in quite a dark period. Not very much advanced from the blood letters.
Mm-hmm. I understood. I share the practice with you insofar as diagnosis or calling systems or symptoms or grouping them together that way, and seeing each experience as being unique and information to use to assist with the individual. And indeed, autism is a great misnomer. You say a little bit more about to assist. I've served many families with children who have been diagnosed or labeled as autistic. Could you say a little bit more about that misnomer to help them better understand what's happening from a physiological or biological standpoint?
Well, again, there are many roads to Rome, but the vast majority of those affected with this spectrum syndrome at the moment are there because they have had either a post-encephalitic syndrome from the damage to their immune system from the combination of vaccines or one of the vaccines, to actually still having an active encephalitis still taking place. Because once the situation gets set off, one's immune system is severely effective, you become a sponge to all sorts of co-infections and viral infections. You can't get rid of them. They get in your brain, whether that's human herpes virus number 6 or Epstein-Barr virus, and those things be treated. So there's sometimes a very active infectious disease component to many of the individuals who have autism. There are metabolic issues that need to be corrected. They have sensitivities to gluten and casein. There's damage sometimes in their methylation cycle and their detoxification kinetics, so that has to be supported. So it gets to be very complicated, and almost every patient is a new personal individualized case that must be approached. There's no cookbook. In other words, there's no cookbook formula, one magic pill that will take care of everybody, and that's it's very time consuming and it's very complicated, and quote unquote conventional modern medicine does not have any tolerance for this. It doesn't have the time. Physicians, sometimes I spend 3 hours on the first visit with people. What regular medicine clinic can have a physician devote 3 hours to a patient, when they come in? There's no such thing. It's unheard of, but that's how intense things have to be, and the vast bulwark of physicians just say, this is, I don't have anything to do with it, or they'll just dismiss it. Oh, that's autism. What do you expect?
Or it's a behavioral issue. Be
Right.
more strict with your children.
Right. So after the pediatricians, who were the witless dupes of the pharmaceutical companies that were
Don't hold back now. Don't hold back now.
Yes, stupidly injecting things without any a sense of accountability or knowledge of what they were even doing or what was in the vaccines, damage they were causing. I put psychiatry right behind the pediatricians as being responsible for keeping the ignorance and obfuscation of this epidemic going, because they have owned it as some kind of behavioral psychiatric illness when it's a medical problem and it needs to be treated medically.
So I see that this is a place where both you and Dr. Amen can meet. As you said before, it's an area of medicine where the past 150 years that the brain wasn't looked at. What the organ that they were treating, essentially, though it's much more than the organ itself, wasn't being looked at. So I reckon that this is a place where the two of you can meet and move forward in serving the community on the same page, and that's a great foundation to really grow with.
That's our hope.
I applaud your hope and support it in every way I can. The hypothalamus. I'm not sure that we really landed with that question, and I am curious if you've noticed a correlation, particularly with oxytocin production, overproduction, underproduction, overactivity. If that's come up, or if that's something that hasn't really been addressed or looked at.
Well, no, it has been addressed, and many individuals do have oxytocin deficiencies. Now, it's not something that can be tested for, really. The oxytocin levels in your blood don't necessarily reflect the oxytocin levels in your brain, and even if someone could determine easily the oxytocin levels in your brain, that may not provide all the information needed, because if you don't know when that hormone needs to surge, whether you're capable of providing that surge in your brain. So there's no question that there are people who are oxytocin deficient and benefit from receiving pharmaceutical level doses of oxytocin.
Mm-hmm. I won't ask you to speak for Dr. Amen, but how is it for you working in a clinic with a psychiatrist? How have you grown as a physician, or how have your practice grown, the latitude and different possibilities in ways you practice medicine?
Well, my practice hasn't changed too much, except that now I have access to these great functional brain scans called SPECT scans. So it really adds a level of insight that I never had before, and almost 80% of the time the information coming from these functional brain imagings either changes the diagnosis or changes the treatment of that patient. So they may come in thinking that they have a little memory problems and they want help with their attention deficit disorder, and then they find out that they've actually had somewhere along the line a devastating traumatic brain injury, or a series of them, and that's actually their main problem. So it's been very rewarding and helpful to have that piece of information to help patients with.
Sure. It can be tremendously helpful and relieving to find out that and kind of an illness or imbalance isn't somebody's fault. You know, a lot of people, when they're ill, will punish themselves, especially if they can't necessarily put a finger on it or compare how they function from any given day, how they're acting in life today compared to how they were 10 years ago or 20 years ago. But to have that moment of, oh, it's that thing, it's not for me to take personally. And I feel that's an important thing for people to remember in their process of recovery, is to give them space to be human and give them space to have experiences.
Well, the thing about a brain injury is, and I use the analogy of the wolf man. The wolf man knows he's going to turn into a wolf, at least once a month, and he can consciously make decisions about what he's going to do when that happens, whether he's going to chain himself in the basement or get dropped off into the woods of Saskatchewan where he can roam free as a wolf but probably not run into anybody. And the thing with a brain injury is you don't even know you have the brain injury. You don't know you're the wolf man. You can't make any conscious decisions about what you're going to do if you become symptomatic, because you don't even know why you're becoming symptomatic. And so it seems unfair that so many of us have brain injuries or brain imbalances, and we have no way of knowing about them, and there's no way to get help from anybody except in a clinic like the Amen clinics, where we actually look in the brain and go, oh, well, that's what's going on. That's why this or that or the other's taking place. So it's a start, and I call it clinical neuroscience. That's my name for this new field. And
good name.
I'm hoping that it catches on, because a lot of people need the assistance.
Yeah. Assistance also in communication for the families who are wanting to dialogue with their physician and help. You have a situation of a family that doesn't speak doctor language, that they are just trying to do the best they can for their child. They're trying to understand it. They're also coping with their emotions and these added responsibilities that they didn't necessarily anticipate being possible, being a parent. Here's this whole other set of rules that they have to learn, and a whole language and a whole system to navigate. And then they're going to this doctor, and they may be well received. They may have an educated doctor in these areas you practice in, or they may get, or it's a behavioral issue, be more firm, send your kid to military school, or something kind of extreme where they're really not listening to their patients. What script or text can you give to families like this in this situation to assist in breaking through, to make a connection to that physician that may be their physician, for better or worse, to penetrate the matrix? What text can you give them to say these words to your doctor, and maybe it will help them to listen to you?
Oh, I wish I had the answer to that question.
No magic pill for that one either.
No magic pill. In fact, it's worse. It's worse than that, because we have active obfuscation going on. So let's say you came to your doctor and said, I hear my lab results from a specialty lab showing I have chronic Lyme disease, and I've had it since I got bit by a tick 20 years ago, wherever it happened to be, and even if you present the facts, they'll say, I don't know that lab, I'm not familiar with them, I don't believe them, but here's 3 weeks of antibiotic, because that's what the CDC, the Centers for Disease Information Control, says we should be doing. And of course you've done your own research, and it says it's going to require more than one antibiotic, and for more than 3 weeks, probably more like 3 years than 3 weeks. And they'll say you don't need it. There's such a thing as chronic Lyme. You can't have Lyme. So that's what I mean about the dark ages. Seriously, this is I'm not just saying that because it's some kind of nice soundbite catchword. Physicians are under a mind control by both government and then there's an unholy alliance between pharma and certain governments. So this is essentially the corporatization and corruption of the people and the institutions that the people depend on, so that they can be controlled and others can profit by that control. And it's that simple. And I don't know how to say it without sounding like a conspiracy nut, but you talk to anyone with chronic Lyme disease,
Understood.
And they'll tell you the same thing.
Understood. And to that I would say thank you. I appreciate that to the families that are listening. Even if you're in a terrain where kind of this medical language is unfamiliar to you, I want to say to you, you are not without your knowledge. So even if you may feel stress or anxiety, or even sometimes a point of desperation looking for help, you still have your knowledge in this, you still have a situation and you're seeking help to address the situation. And there's going to be many people as a part of your team to help you. And if there isn't a landing, or you felt that you're not being seen or being heard or being appreciated by your physician, please move on. Don't stop there. Today we meet Dr. Stoller in California, and there are other physicians and other people that are here to be of service and to assist you in your growth. Blessings to you, Dr. Stoller. Blessings to you for your work, and Dr. Amen as well. And what the two of you are creating together. You've had your own clinics before merging with his. So it's a pretty powerful alliance, and one I'm predicting that other people begin to get hip to. So you've both been doing this work, but in some ways it's also a model or a pilot program that other physicians, psychiatrists, and healers can adopt around the world. So I feel that coming along and support healing.
Thanks. Well, we're trying.
You are very welcome. You said something else before we go. You said something else that caught my attention. That you felt, back to oxytocin for just one moment, not to be confused with Oxycontin. That it's a natural hormone that the body produces, but it's also prescribed to give to patients. It can only be it's strictly a prescription medicine. It's not an over-the-counter or a recreational thing. That most people can take it. There are some exceptions, and that you felt that most women should take it up to a certain age or a certain experience in their life. What are the contraindications to oxytocin?
Well, you don't give oxytocin to an active opioid addict because it'll act like Narcan. The oxytocin occupies some of the opioid receptors, and it'll block their whatever they're taking, be it heroin, methadone, or whatever other narcotic they're on, and it'll put them into withdrawals. So unless that's what you want to be doing, I would not use it. Would not give it to someone who's addicted to opioids. At least not at the first part of their intervention or rehabilitation. I wouldn't give it to a woman who's anxious that she's going to be delivering a baby in 3 or 4 weeks, because she might deliver the baby right there in front of you, because there are oxytocin receptors on the pregnant uterus of someone in their last trimester. So the two big groups you don't give it to. And like I said, there's always somebody who's a contraire, and they'll have an unexpected reaction to something. So there's nothing that I've ever come across that works 100% of the time on 100% of the people. So you always have to be on the alert for that. And it is a prescription in the United States. It's probably a prescription in many countries. Now the pharmaceutical companies make a synthetic oxytocin. I'm very much against using synthetic hormones for anything. You want bioidentical oxytocin, and that has to, in the United States, that has to come from a compounding pharmacy. And but that's what you want.
Yeah, molecularly speaking, how similar or different is it to, let's say, dimethyltryptamine?
Dimethyltryptamine is what's similar to dimethyltryptamine is actually melatonin, and that is the other hormone that comes out of that same area of the brain. The oxytocin comes out of the exact area where vasopressin or antidiuretic hormone comes out, but the melatonin, which is released fairly close by, that's actually almost identical to dimethyltryptamine, and melatonin will antidote oxytocin, so you don't take them at the same time.
Okay.
So that's your molecule in the brain that's closer to DMT.
Okay. So there's also a relationship there, and just kind of looking at interactions. I'm just feeling about oxytocin and the pineal gland, and neurontin and these other biochemical activities in relationship. If I take this, what happens, and what else is giving way to that? So just feeling about these things, seeing molecular structure. So want to ask on that. Please give us your website again, and where we can get the Oxytocin book if some folks are just tuning in.
So the Oxytocin book can be downloaded for free at oxytocinhealing.com, and you can also gain access to that through the portal griefsos.com.
Mm-hmm.
And so those are the two main websites for the Oxytocin book. Now, a lot of people don't like reading books electronically, so Amazon sells the little book I wrote on oxytocin for $3.60, so you can't beat the price.
Yeah, it's a good book, worth the read. And so priorities, Dr. Stoller, in your experience, how do you feel your soul is informing your work this lifetime, and how you are growing with your work in service to humanity?
Well,
where do you feel that alignment?
That's a mouthful. Well, I on a personal level, I hope my soul and my personality are well integrated with each other, and I just try to stay in the unified field and go with the flow and be of service. So not to worry about too much else. Not always easy, but that's the way it goes.
Beautiful, beautiful. You are a good man, Dr. Stoller. It's an honor to know you and to work with you and to receive you here today on Soul Priorities. I'd love to have you back in the relative new future. I know you have other work and have written other books that take us in another direction, so it'd be great to connect with you again for that and share that work with our listeners here today.
Thanks for having me, Tuaca.
Thank you. We'll see you again.